Hello everyone. In this presentation, I am going to explain in detail about an ultra simplified technique of cleaning and shaping using Protaper system. Protaper system is one of the widely used and well accepted technique for cleaning and shaping of root canals. This is a very efficient and a simple to use system. In this presentation, I am going to tell an simplified technique by which you can use reduced number of files. At the same time, you can get the equal efficiency in cleaning and shaping. I have added some videos along with this presentation so that it will be easy for understanding for each and every one of you. I am Dr. Benin and I have done more than 25,000 root canal treatments in a span of last 12 years. And I am very sure my expertise in doing root canal treatment will be helpful for each and every one of you. So stay focused and watch until the end of this presentation and it will be really helpful. In the last presentation, I have told that for cleaning and shaping using Protaper system, we have to use the rotary files, that is the Protaper files, in a sequence of SX, S1, S2, F1, F2 and F3. If you haven't seen that presentation, I will put the link in the description, so kindly go watch that presentation before continuing with this. That will be really help you for understanding this presentation in a greater depth. That is just a 10 minutes presentation. Just go and watch that before continuing with this. And if you are aware of the Protaper sequence, let's proceed with the presentation. We all know that the first file that needs to be used in cleaning and shaping using a Protaper technique is the SX, which is a shaping the coronal orifice, followed by S1, which will enlarge the coronal 1/3 of the root canal system, and S2 will enlarge the middle third of the root canal, and F1, F2 and F3, depending upon the size of the canals, we can enlarge the apical 1/3 of the root canals. But this technique may be little more time consuming, and is it possible to reduce the number of files at the same time getting the same efficacy in cleaning and shaping? Yes, in many circumstances we can skip or minimize the use of S2 and F2 for cleaning and shaping. Let's see a demonstration in this presentation how to do. So going back to the steps in doing root canal treatment, and for doing cleaning and shaping, first we have to locate the root canal orifice. So after locating the root canal orifice, we have to negotiate the root canals, followed by a glide path preparation. And after creating a glide path, you can determine the working length. If you are determining the working length after creating the glide path, the chances for the working length to change during cleaning and shaping will be minimal. And after that, you have to move with the rotary instrumentations. That is, we have to use SX followed by S1, and according to the manufacturer's recommendation, we have to go with S2. But instead of using S2, we can skip that file and we shall directly go to finishing file F1. And after using F1, instead of using F2, if necessary, we can directly go to F3. I will be talking about what are the circumstances where we should not skip the file F2, but in many circumstances we can. And after enlarging the canal with F1 or F3, depending upon the canal apical size, we shall select the master cone and then we can obturate the root canal system. So let's see about each and every one of these steps in detail with a video. First, we shall proceed with the orifice location. For this presentation, I will be using this study model, which is a typhodon tooth and which has a clear anatomy of the root canals. In this video, you can see the anatomy, and it has 3 canals in this model, and we shall enlarge, do cleaning and shaping of this study model in the coming session. The important step is we have to locate the root canal orifice. There are different techniques which are recommended for locating the orifice, but the technique which I follow and I recommend is to use a DG16. A DG16 is a orifice locating endodontic explorer. So with the help of a DG16 instrument, just we have to move the instrument in the pulpal floor, and it has the sharp tips. You can use either of the tips depending upon your comfortness. And once the tip comes into the root canal orifice, it will get bounded. Once it gets bounded, we will know that that is where the root canal orifice is present. So then we shall proceed with the next step, which is the root canal negotiation. So but always keep it in mind, before root canal negotiation, we should always use irrigation to fill the pulp chamber. So irrigation should be the first step that you are using after root canal orifice location. Once the orifices are located, we should fill the entire pulp chamber with a root canal irrigant. Here we can see that I am using a 30 gauge side vented needle. I prefer the use of a 30 gauge side vented needle for root canal irrigation, even in case of curved canals. People often recommend that the metallic files with like the 30 gauge files cannot bend in curved root canals and reach the apical part of the root canals for irrigation. But I am using this file for so many years, and I feel like that this needle is flexible and it will reach the apical 1/3 without any doubt. So we can use any side vented needle, we can use any side vented needle of 30 gauge size. So after filling the pulp chamber with the root canal, we shall proceed with root canal negotiation. So we shall now negotiate the canal. Here comes the big question: which size file and what length file you are going to use for root canal negotiation. Here I have put some 4 files. The white color ones are the number 15 and the purple ones are the 10 size. So I have placed 2 15 size files which are 21 millimeter and 25 millimeter, and 10 size files of 21 millimeter and also a 25 millimeter. So which file can be used? Often it is recommended that we should always use a 10 size file for root canal negotiation, but I often use a 15 size file because I feel like that I will have a better control, and the 15 size file is more rigid, at the same time small enough to negotiate most of the canals. If whenever I find some difficulty in negotiating with a 15 size file, I will not push the file so hard. I will stop immediately and I will proceed with a 10 size file. But for most circumstances, a 10 size file is not needed. If you are using a 15 size file, the 15 size file will be more resistant for fracture, and for canal negotiation we need a file which is more rigid. 15 is more rigid and also more resistant to fracture, but flexible enough to travel through the curved root canals. So it is better to use a 15 size file. The next doubt is whether you will use a 25 size file or a 21 millimeter file. People often consider that with the help of a 25 millimeter files, you can negotiate short root canals and also at the same time the longer root canals. But I always prefer that with a shorter size file, that is 21 millimeter file, we will get more tactile sensation for canal negotiation. So the the file which I recommend for canal negotiation is a 15 size 21 millimeter file. Try to use this file and you will be happy and you will never regret for using this file, because that comes handy in most circumstances. Okay, let's now see how to negotiate the canal with the help of a 15 size 21 millimeter file. For negotiating, it is recommended that we can use a watch winding motion. So what is this watch winding motion? We have to place the file inside the root canal. Then we have to give a small clockwise and counterclockwise movement. So it is called as a watch winding movement for watch winding motion for canal negotiation. But looking at the truth, we will not be winding the watch like this, and I prefer the term maybe like a vertical manual reciprocation technique, which can preferably better explain the movement than a watch winding motion. Maybe in the future we can discuss more about this, but for this presentation we can keep it as a watch winding motion, although personally I prefer the word or the term a vertical reciprocation technique. Okay, let's keep it as a watch winding for now. Okay, so each canal we have to negotiate using a watch winding technique. We have to place the canal. It will get binded from the orifice. You have to push the file a little and with a clockwise and counterclockwise rotation, not more than 30 to 45 degree in each direction. So with the help of a 15 size file, make sure that you negotiate. If you find any hindrance in negotiation with this file, or after negotiating to 21 millimeter with the file, you find that it is too short, then you can negotiate or continue to negotiate with a 25 millimeter file. But for a premolar and for molar, in most circumstances, a 21 millimeter file will be more than adequate. 25 millimeter files may be helpful for longer teeth like the anteriors, and maybe a 31 millimeter file will be needed to negotiate a very long rooted a maxillary canine in many circumstances. So after canal negotiation, keep it in mind, for canal negotiation we should never use EDTA. People often recommend the use of EDTA for canal negotiation, but I do not recommend the use of EDTA in a gel or either in solution form for canal negotiation. In my clinical experience, I have understood that if you are using EDTA for canal negotiation, you will end up creating a ledge, or you will end up creating a canal transportation or apical perforation. So I do not recommend the use of EDTA, and if you are using EDTA, it will not only soften the calcification, it will also soften the dentine. For EDTA, dentine and calcifications are both just the same. So if the dentine gets softened in case of a curved root canal, at the curvature, it will stop, the file will start digging a small perforation at the curvature. Keep it in mind, all hand files will have an active cutting tip. So if you are using a stainless steel file and EDTA, you will end up with more problem and not benefit. So do not use EDTA for canal negotiation. After canal negotiation, once the full length is negotiated, then for canal enlargement you can use EDTA. I am not against that. So after canal negotiation, we have to create a glide path. So while doing canal negotiation, we place the file and we gave a small right and left, that is clockwise and counterclockwise movement, to reach till the full length of the canal. But for canal, after canal negotiation, for glide path, you have to push the file in a vertical stroke to reach the entire working length, and then you have to take the file out. and then maybe you can push the file inside and pull it out in short strokes. So this is called a glide path preparation. Without creating a glide path, we should never introduce any rotary files. So there are some recommendations that we can use some files like Pathfinder, some ProGlider. All these files can be used for creating glide path. But if you are reading the manufacturer instructions, they always recommend the canal should be enlarged up to 10 or 15 size hand file. Then only the rotary files are recommended. So please do not jump into some decisions of skipping the hand files for canal negotiation or for creating the glide path. Although the names and they are marketed for glide path preparation, I always prefer using a 15 size hand file for creating the glide path. That is more economical, and by doing this you will never break a rotary file in your lifetime. So after creating a glide path, and as I always say that the root canals and the access cavity should be always filled with root canal irrigant solution. Keep it wet throughout the root canal preparation. So after that, at this stage you can determine the working length. So you can use an apex locator and you can confirm with a radiograph. Maybe people recommend that you could determine the working length before immediately after canal negotiation, and you have to reconfirm before master count selection. I do agree, but it is better to place a file at least to the size of 15 while determining the working length. So a file lesser than a 15 size will not be clearly visible in a RVG or in a radiograph, and it may lead to misreadings while determining the working length. So by determining working length at this stage, the chances for the alteration in the working length after doing cleaning and shaping will also be minimized. So it is always preferable to determine the working length at this stage. After that, after determining the working length with your preferred technique of choice, then we shall move on with the next instrument for cleaning and shaping, which is the SX, that also called as the Shaper X. Keep it in mind, whenever you are starting your cleaning and shaping, there may be a chance that file may get binded and it will pull the file inside the root canals. As recommended by the manufacturer, SX need not have to be pushed inside the root canal till the full length. But if the canal is wide enough, you can go to a greater length. Nothing bad is going to happen. But do not push, if the canal is calcified, do not push an SX till the full length. In the last video itself, I have mentioned that the length of the SX is short. It is 19 millimeter. So no need to push till the full length, but if the canal is wide enough, as in this circumstance, that is in this typodont teeth, it is quite wide. So in these circumstances, if it is needed, we can go even to a greater depth. It's not a problem. But one more problem that you will find while doing cleaning and shaping with SX, that is canal enlargement with SX, the file will get binded and it is called as the screw in effect, and the file may get bounded and it may stop, it may counterclockwise rotate because of the endomotor, and the file may be pushed out. That frequently happens because the space between the flutes of the SX is too more. So this may get, so in order to overcome that, for SX we can keep a torque setting to a higher level, maybe around 3.5 or 4 you can set in your endomotor, so that we can avoid that. But for the remainder of the files, maybe as the files you are going using a finisher file like F1, F2 or F3, you can set the torque to a lower level. But I recommend that to a standard, maybe as a beginner, you can set the torque at 3 and a speed at 300 RPM will be ideal in most of the circumstances. Okay, after using SX, again irrigate well, then you should proceed with S1. You should never ever skip S1. This shaper 1 is very important. Because if you are skipping this S1 file, you may end up fracturing the finisher files. So never skip S1 while doing cleaning and shaping. Keep it in mind, with SX you need not have to go till the working length, but with S1 and all the consecutive files which are yet to come, we should always go till the determined or the predetermined working length. So you have to use at 300 RPM and maybe the torque setting of 3. With the help of S1, we are going till the working length. So after going with an S1 till the working length, we can see that the coronal 1/3 of the root canal is clear and the red color, the color which is mimicking the pulp tissue is removed. That indirectly tells, but the apical end, the red color is still remaining. That tells that S1 is going to prepare only the part of the canal and it will not provide an apical preparation. And if you have created a good glide path, and the chances for the SX or S1 to fracture is almost negligible. So always keep it in your mind that you should enlarge the canal with the hand file, create a glide path, then you should use SX to enlarge the orifice, and with S1 you should go till the working length so that the coronal 1/3 of the canal is prepared. And after preparing with S1, this is where we are skipping S2. Why are we skipping S2 and we are directly jumping to F1 is the S2 provides an enlargement in the middle third of the canal. But if you are skipping it and if you are using F1, it may be a little extra burden for the F1. But again, with the help of S1 and F1, the middle third of the canal will also be prepared completely. So it's not that the pulp tissue will remain in the middle third of the canal. No. So this is an F1 file which has a yellow stopper and yellow color band in the handle. So we are using at the same speed of 300. Maybe the torque can be reduced to 1.5 or 2, but 3 is also okay. So with this file also you have to go till the working length. Always keep it in mind, you should never force a rotary file to reach the working length. So what we are supposed to do is use gentle forces, and maybe you can use a little pecking motions also, not a problem, but never force a file. If you are forcing a rotary file to go inside the root canal, then it may get binded and it may fracture. Maybe in a presentation I will explain in detail why a rotary file will break and how to minimize a fracture of the rotary files. In my practice, one of the file may get fractured inadvertently, maybe 1 in 300 or 400 root canal treatments which I perform, nothing lesser than that. So just imagine if you are fracturing a file or a file gets separated 1 in 300 or 400 of the root canal treatments. So that is almost like negligible. So I will tell the reason that why a file fractures. If you can understand the concept, why a file gets separated, binded, and what are the types of fracture and how to minimize this fracture, you will become a better person doing cleaning and shaping, and you can do root canal treatment without file separations. So just you are using a F1 file to reach the working length, and till the F1 will provide an enlargement of tip size 20. But in many circumstances, like maybe the mesiobuccal and the mesiolingual canals of a mandibular first molar, maybe the mesiobuccal and the distobuccal canal of the maxillary first molar, and if there are 2 canals in a maxillary first premolar or second premolar, in all these circumstances, it is enough to prepare the canal with F1. Directly we can go for obturation for these canals. Why? Because you may say that is 20 sufficient enough to provide sufficient enlargement, but it is not 20 alone. That the Protaper F1 will have a taper of 7%. So 1 millimeter short of the tip will provide an enlargement of 27, and each consecutive millimeters will provide 7 size, that is ISO size 7 or 0.07 millimeter extra or bigger size preparation. So it is more than adequate. And once you have enlarged the canal with F1, and if you feel that the file is still loose, or if you are using a 20 size hand file, and if it is the hand file is not binding at the apex after enlargement with F1, then we may have to go with F3. So F3 has a tip size of 30 and a taper of 9%. So you should use most often in case of the palatal canals of the maxillary molars, or the distal canals. If there is a single canal of a mandibular molar, then you can go with F3. So you can enlarge the canal, and you can see that at this circumstance I just want to pause the video and I want to show something. In the root canal tip, you can see that there is the extrusion of the pulpal tissue through the apical foramen beyond apex. This is the reason for the post-operative pain. However good we are, whatever the file system you are using, however the gentle pressure that you are applying, whatever the root canal irrigation you are performing, still there are high chances that there will be extrusion of debris and the necrotic pulp tissue, bacteria, everything going beyond the apex. If this happens, there is chance for post-operative pain. I have made a separate video what are the reasons for the post-operative pain, and if your patients are coming back after cleaning and shaping with pain, you may have to watch that the video. I will add that link also in the description. So here you can see that there is a debris which have accumulated in throughout the canal, throughout the flute, especially in the coronal and the middle third, and maybe it is free in the apical third, but it is not always a conclusive factor. People often say that we can determine which part of the canal the file is preparing, maybe in some circumstances, but these are all not conclusive. These are just tentative figures. That doesn't mean. So if there is more coronal debris, and whenever you are removing the file from the root canal system, obviously it will the debris will get gathered, and all these files are designed in such a fashion that they will try to extrude the debris through the orifice that we are preparing. So that they are not very conclusive factors, but still, for as there is so much of debris, I am just explaining about it. After that, you have to thoroughly irrigate the canal to remove all the debris which are present. And while doing irrigation, just do not apply so much pressure, and do not go till the working length, maybe 2-3 millimeters short of the working length. You can insert and you can do the irrigation. And you should also keep it in mind that the file should be rotating in the recommended speed from the starting till the file is removed from the canal. People often say that whenever you are starting with your cleaning and shaping, and you can place the file inside the root canal so that it will be easy to differentiate the canal, which canal you are preparing, then you should start the endomotor. No, it should not be done. Okay, so you should be always having the file which is rotating, and the rotating file only should enter inside the root canals. So after finishing cleaning and shaping, thoroughly you have to irrigate. Irrigation is very, very important, and after that you can choose the respective master cone up to what the size that you have prepared. The mesiobuccal and the distobuccal I have prepared till the F1, so I have taken two F1 cones, and the palatal canal I have prepared till the F3. So I am taking one F3 cones, and after that place the cones with the help of a locking tweezer. Hold it and gently place it inside. Again, do not apply so much pressure while applying the master cones, and once you get a proper tuck back, take a radiograph. Make sure that the cones are up to the working length, or maybe 0.5 to 1 millimeter short of the working length. Now you are free to proceed with the obturation. Okay, so we shall see about the obturation procedure in some other presentation. So to summarize this presentation, I would say that first you have to locate the canals with the help of a DG16, and if you do not have a DG16, you may use a sharp straight probe, but I recommend to use a DG16. Then you have to irrigate well throughout the canal preparation. Then you have to use a 15 size 21 millimeter file to negotiate the canal. If you feel get a good resistance, then you may go with a 10 size file. Otherwise 15 size file will be more than sufficient in most of the circumstances. After negotiating the canal, irrigate well, create a glide path with the same 15 size file, and without creating a glide path, never ever use rotary instrumentations. And after that, you have to proceed with a working length determination. Then use SX followed by S1. You may skip S2 in the sequence. Then you can go with F1. F1 is mandatory. Do not apply so much apical pressure while doing cleaning and shaping. If you are applying apical pressure, then the file may get separated. After doing this, you can proceed with a hand file. You can determine whether you are getting a binding with a 20 size file at the apex. If not, you may proceed with F2 or F3, but in many circumstances F2 is not needed, and you can directly go with F3, especially the wider canals, young patients, and the palatal canals of maxillary molar, the distal canals of the mandibular molar, and maybe any of the anterior teeth except the mandibular incisor may require F3. And there are some files F4 and F5. Maybe for some anteriors you may need those files for cleaning and shaping. I hope that you have got a little idea about this simplified technique of Protaper cleaning and shaping. I hope this will be helpful for you. So before proceeding with the patient walks, practice enormously in extracted teeth. I used a typhodon model in this just so that you can see the cleaning and shaping happening, but I recommend instead of a typhodon model, you can, and it is better to use an extracted teeth for practicing. You will get that natural feel, and with the plastic models there are more chances that the file will get binded and there will be a suck in or the screw in effect will happen. But with the natural teeth, the chances for that happening is quite less. And truth to be told, doing root canal treatment following this technique is very, very simple and easy. So follow this technique, and if you like this presentation, give a thumbs up and subscribe to my channel. I will come and I will meet you people with another better video soon. Stay focused. Thank you for watching. We will meet soon. Have a nice day.